This is everything you need to know about iron deficiency anemia. What is the hemoglobin level in anemia? It's less than 12.5 grams per deciliter in females and less than 13.5 in males. What's a low iron intake due to? It can be due to low eating, not eating enough in the diet, not absorbing enough due to celiac, or gastrectomy, or bleeding, excessive bleeding, aka hemorrhage. What is a malabsorption disease that can cause it? Celiac disease. What are some general symptoms of iron deficiency anemia? It's due to low RBCs, low oxygen, so you'll get fatigue, poor concentration, pallor, pale skin, pre-syncope and syncope. What are some specific symptoms of IDA? This includes cracking at the corner of the lips. Cracking at the corner of the lips is known as angular cheilitis. Eating dirt is known as pica. The spooning of the nails is known as koilonychia spoon. Flattening of the tongue is known as atrophic glossitis, and those greyish ulcers of the mouth are known as aphthous ulcers. Moving on. What is something specific to do with the lower limbs with iron deficiency? So you can get restless leg syndrome, which is just due to that iron deficiency. What lab values may we see in some patient with iron deficiency anemia? So you'll have low serum iron and low ferritin. Low ferritin is because ferritin is the stored form of iron, and when you have low iron, you're going to have low storage of iron eventually. But transferrin is going to be high. Transferrin is what binds the iron in the blood. But if you have low iron, then you'll have a lot of transferrin just free floating around, unbound. The unbound transferrin is what increases. Remember, only 1 in 3 molecules of iron actually bind to the transferrin. So transferrin, the unbound transferrin, will increase because there is less iron to go around to partner up with transferrin. TIBC will increase and RDW will increase. RDW, total iron binding capacity. As soon as the ferritin stores become low, which is a stored form of iron, the TIBC, which is the total iron binding capacity, will increase and skyrocket, and that's because they have an opposing relationship. When stores of iron are high, ferritin's high, the TIBC will then be low. Why is the red cell distribution width high? Because remember, IDA initially starts off normocytic and then it becomes microcytic. Because initially, the bone marrow is producing just fewer red cells, but normocytic. What is the MCV? MCV is the average volume of the red blood cells. What do you mean by hyperchromic RBC? Look at that zone of the central pallor. It's much greater, it's bigger, it's big than just 1/3. What is the initial investigation? A full blood count, FBC. What might be the gold standard investigation in iron deficiency anemia? It would be a bone marrow biopsy, though that is not practical and it's not as done. What is the main treatment of iron deficiency anemia? Well, what's the problem? Lack of iron. What are you going to treat it with? Give it iron. So we're going to give them iron. And we're going to give iron supplements with laxatives because iron can cause constipation. Why might we give a patient with iron supplements laxatives? Because iron supplements can cause constipation. Why might a patient with iron deficiency anemia excrete black stool? Because the supplemental iron you give this patient, aka the treatment, the iron, can cause black stool. Here are the features: angular cheilitis at the top, koilonychia, then angular stomatitis, then pica, eating dirt, and the ulcer, aphthous ulcer. Now, iron is a key component of RBCs, that's why we get iron deficiency anemia. When transferrin is low, that means the unbound transferrin is low, meaning a lot of the transferrin is now bounded with iron. And if it's bounded with iron, that means we have plenty of iron in the bloodstream. But if there's not enough iron, the levels of free transferrin will be higher in the bloodstream. And ferritin is the stored form of iron, so don't forget that either. When the iron is absorbed in the gastrointestinal tract, it's absorbed by these enterocytes, and the molecule that absorbs them is ferroportin.